In this video, we are going to be discussing shock. Now, you might be wondering what exactly shock is, and it is also known as circulatory failure. And it basically happens when the metabolic needs of cells aren't met because of poor or inadequate blood flow. So I'm just going to write that down quickly here. So, poor, inadequate blood flow is what is leading to the metabolic needs of cells not being met. So there's a few different types of shock, but before we get into that, I'll explain what exactly happens in the body when a person undergoes shock. So, in shock, a few things happen with the body. First of all, there's a reduction in circulating blood volume. So, I'm just going to draw a downwards arrow to represent a circulating blood volume, or a decrease of it. Next, a person may also have a decreased blood pressure. And again, blood pressure is the amount of pressure blood is expending on the vessel that it is in. And lastly, a person may have a decrease in cardiac output. And cardiac output is essentially the stroke volume of the heart times the heart rate. So, stroke volume times heart rate. And the stroke volume is basically the amount of blood the heart is able to pump out with one stroke or one contraction times the heart rate. So really, cardiac output is measured in liters per minute. So, as I've said, there's a few different ways of classifying shock, and those ways include the causes of shock. So, I'll go straight into the first cause or first type of shock, and that's hypovolemic shock. Hypovolemic shock. Now, hypovolemic shock basically occurs when there's a decrease in blood volume by 15 to 20%. So, and we can see that here in our original definition of shock. So, decrease in blood volume by 20 or 15 to 25%. And causes of this may include hemorrhage or cuts where whole blood is lost, so loss of blood, as well as extensive burns where the serum of blood is lost. So that's hypovolemic shock in a nutshell. And basically, the reason it's going to cause shock is because a decrease in blood volume, first of all, is actually going to deliver less nutrients to your cells in the same amount of time. But also, a decrease in blood volume is also going to decrease blood pressure, which may cause venous pooling. So next we have cardiogenic shock. And from its name, we can already tell that it has something to do with the heart, because of that phrase cardio in there. So cardiogenic shock basically happens when acute heart disease damages heart muscle, and therefore the heart muscle cannot maintain that stroke volume or heart rate we're looking for, so cardiac output goes down. So damaged myocardium and myocardium is just a word for heart muscle, and because of that we have a decrease in cardiac output. But we also actually have a decrease in blood pressure, since blood pressure can be measured by cardiac output. Times peripheral resistance. And peripheral resistance basically means how much a blood vessel is constricting, or an artery is constricting. So if we have a decrease in cardiac output because the heart is failing, we're also going to have a decrease in blood pressure. So not only is the heart unable to pump enough blood to meet the needs of cells, but also there may be a bit of venous pooling and not enough pressure to get that blood there in the first place. As well as, I'm going to draw here, a decrease in blood pressure. So one example of when this might happen is myocardial infarction, which is basically when the blood or coronary arteries, which supply the heart with blood, are obstructed due to thrombosis or infarction and cause infarction. So our next type of shock here is septic shock. A septic shock basically takes place during sepsis. And in sepsis, basically what happens is there's an active infection in the bloodstream, and the body reacts to this infection by using its white blood cells. So, bloodstream infection. So we have a bloodstream infection and the body wants to use, I'll just draw it quickly here, it wants to use its white blood cells. So it's leukocytes. And some of these leukocytes, when they detect an infection or a pathogen, they're going to release certain hormones or chemicals that actually cause vasodilation. So these are going to release hormones, and examples of this include histamine, and these are going to cause vasodilation. So I'm just going to write here vasodilators, so we know that what it's releasing actually dilates the blood vessels. So any vasodilation means our blood vessels dilate. So I'm going to draw an up arrow and say vasodilation. And you might be wondering how exactly this causes shock, and really that's because severe and extensive vasodilation is going to cause a huge decrease in blood pressure. Remember, because we said blood pressure is cardiac output times peripheral resistance. And peripheral resistance is basically the equivalent to how much vasoconstriction or dilation there is in the body. So if you decrease the peripheral resistance a lot through vasodilation, you can get dangerously low levels of blood pressure. And because of that dangerously low amounts of blood pressure, you can have venous pooling, where basically the blood doesn't have enough pressure to return to the heart because after traveling through the capillaries, and because of that, our stroke volume may be reduced, or the blood just doesn't have enough pressure to get to all of the cells it needs to in the first place. Next, we have neurogenic shock. And you can already tell from its name again that it has something to do with the brain. Neuro, as in nerves or the brain. So some causes of this include sudden acute pain, so sudden pain, or intense emotional experience, or other possible spinal cord damage. Now, what actually happens here is these causes all interfere with the cardiovascular center, and they basically interfere with it in a way that causes vasodilation. So, I'm going to draw a quick brain here. And this is our CVC. And these all actually interfere with the CVC. Or you could just think of it as the brain. And this is actually going to cause vasodilation. So an increase in vasodilation and this is going to cause a decrease in blood pressure. And as we've outlined before, this decrease in blood pressure is bad because it makes it harder for all that blood to get to the cells it needs to, and can also decrease venous pressure, which is how much pressure is in the veins, which also decreases how much blood actually gets back to the heart to make sure we can maintain that cardiac output. And lastly, anaphylactic shock. Anaphylactic shock. Now, anaphylactic shock basically occurs during anaphylaxis. In an anaphylaxis, that's basically a severe allergic response. So, it's an allergic response, and it's basically, it can be triggered by whatever the individual is allergic to, such as penicillin or peanuts or latex rubber. And the way this actually causes shock is because our white blood cells think they've encountered a pathogen or some sort of infection within the body. And certain blood cells, such as basophils or mastocytes, are actually going to release vasodilators. And one example of this vasodilator, which is commonly released during this process, is histamine. So, just adding on here, one of these that's commonly released is histamine. And histamine is actually what's going to cause that huge amount of vasodilation, because the body thinks it's encountered some sort of infection or threat, and it wants to get as many white blood cells there at the what's supposedly infected area in order to maintain and deal with that infection. But really, it's not an actual pathogen, it's just an allergy. So we have an allergic response where histamine actually causes this vasodilation, and again, this causes a decrease in blood pressure. So those are our 5 main types of shock, where we have either a shock caused by a decrease in blood volume, shock caused by a damaged heart muscle where it cannot output all the blood that the cell needs it to, neurogenic shock caused by interference with the cardiovascular center in the brain, septic shock where there's a large bloodstream infection and we release all of these vasodilators, or anaphylactic shock where we also release vasodilator chemicals such as histamine because of an allergy. So there's a few I've outlined the physiological changes during shock. It can either be because of less blood volume circulating or a decrease in blood pressure, which causes venous pooling, or because of a decreased cardiac output, which just makes it so that cells don't get all of the blood they need to. But there's a few ways that our body can actually handle these changes, and that's by compensating for it. So here we're going to explore compensated shock. And I've prepared a little chart here just to explain how exactly it works. So, when an individual experiences shock, their body undergoes many processes. And their body, because of this, can actually respond to it to minimize the damage the shock does. So going back, we already know that shock starts out when we have a decrease in cardiac output. So cardiac output, or when we have a decrease in blood pressure, and that I'll just write BR there to symbolize that, or if we have a decrease in venous return, and that's how much unoxygenated, in the case of a systemic circulation, or blood in the veins, is returning to the heart. So these three things are reduced at the beginning of shock. However, after that, the body can actually recognize that these three things have happened. So, first of all, we have the activation of a baroreceptor reflex. And the baroreceptor is basically, in short, if you imagine this is a person's head and this is their neck, we have two arteries in our necks called the carotid arteries. And those supply the front and middle areas of our brain. But in these two carotid arteries, there's two sinuses where the baroreceptors are. And these baroreceptors are actually nerves, or receptors, as you can tell, that detect pressure. And in a case where they detect a low blood pressure, like in our case of shock here, they're going to activate sympathetic activation. So, alright, sympathetic here. And that is going to activate the baroreceptor reflex. So, baroreceptor reflex. Now, what's also going to happen is a low amount of blood pressure is going to release two key hormones, and those are ADH and angiotensin II. So, we're releasing these two hormones. And those are the two main effects that happen right after our body sees that it's undergone shock. So, just going to draw a couple of lines here to represent that that is what has happened. So our bodies have seen a low blood pressure and a poor venous return, so they release a few hormones, and the baroreceptors in the carotid arteries are activated. So you might be wondering, well, what next? That's a good question. So after the baroreceptor reflex activates, what it's actually going to do is send signals to the cardiovascular center. A cardiovascular center, as you might guess, is in the brain and actually deals with everything regarding the cardiovascular system. So it sends those signals and it tells it, I've detected a low blood pressure. And the cardiovascular center responds by saying, alright, increase heart rate, so it's going to send more frequent impulses to the heart, and increase vasoconstriction. And vasoconstriction is not only handled by the CVC, it may also actually be handled by hormones or chemicals circulating in the blood, but for our purposes, we're going to say that the CVC takes care of that. And the release of these two hormones or chemicals actually increases blood volume. So, as you can already tell, we're starting to negate these original bad effects from shock. So finally, we get an increase in cardiac output, and that's because now we have a higher heart rate, right? Cardiac output equals heart rate times stroke volume, but also because we have more blood getting back to the heart. So an increased cardiac output. We have an increased blood pressure now because we've vasoconstricted our vessels and because we have more blood volume and because of a faster or better cardiac output. So an increased blood pressure, and lastly, we have an increase in venous return. And that's because of our faster heart rate now. The heart rate is pumping faster, so now more blood is getting to the heart faster, but also that vasoconstriction and the blood pressure is also very useful in that. So that's compensated shock, and we can tell that that's compensated because our body has made changes to negate these effects. So a negative sign here is what I'm drawing to represent that. The body has made changes to negate those effects. So we started out with these three things: low, and the baroreceptors, and cardiovascular system, and some chemicals as well as other hormones have managed to increase our blood volume, heart rate, and vasoconstriction and negate these effects. And in the case of compensated shock, a person may be able to stabilize without any or little medical intervention and likely won't undergo much permanent damage, so that's good. But because there's a compensated shock, which you may have already guessed, there has to be some sort of uncompensated shock. So uncompensated shock. And as you might have guessed already, uncompensated shock is far more dangerous than compensated shock, and that's because there can be long-term damage to the body. So, uncompensated shock basically means when the cell hypoxia, or the state of not having enough nutrients, goes uncompensated, and that can cause a few things. So, first of all, we'll start with what happens during shock, just like we did for this diagram right up here. So we know we have a decrease in cardiac output, as well as a decrease in blood pressure. So these two things are decreased, and because of a low blood pressure and the heart rate being slower, we actually have a slow capillary flow. So slow capillary flow. So that's a flow of blood. This low capillary flow is actually going to predispose to intravascular clotting. So, which may cause, and I'll draw an arrow for that, intravascular clots. And that's because any slow blood flow really is going to do that. However, we also have some other issues that arise from these two things if the body cannot compensate. So decreasing cardiac output or blood pressure may also cause capillary damage, and that's because of low oxygen levels. So capillary damage. And that's, again, because of poor oxygen and increased weights. Or wastes. Sorry. So that's one effect of these two factors if it goes untreated. However, there's another issue as well. And that's that there's when you have a low blood pressure or cardiac output, meaning the heart isn't outputting that much blood, you also decrease the blood supply to the heart itself. So a decreased blood supply to the heart itself. And as you can already guess, that is actually going to cause the heart to be less efficient. It's also going to cause a collection of wastes. So, you may be wondering what all of these factors contribute to. And these factors all themselves contribute to a decrease in venous return. You might be wondering why is that, and that's because if we have poor capillary flow, we actually make it harder for blood to maintain its pressure throughout the capillaries so that it returns to the heart well. A slow flow as well as clots also makes it harder for blood to flow back to the heart, and a decreased blood supply is going to make the heart less efficient, making it harder to give the blood enough pressure to return back through one cycle. So I'm just going to draw a few arrows here to symbolize that. So this decreased venous return, we have a positive feedback loop here. And I'll explain what that means, but a positive feedback loop is basically when we have a loop that only contributes to itself. So we have a decreased venous return because of all of this, but a poor venous return is also going to decrease cardiac output and blood pressure, thus causing this to be a repeating pattern. Now, there's one issue here, and that's that sometimes a damage to the heart muscle because of this blood supply may become irreversible. So, severe heart damage, and this is irreversible, remember. And this will lead to progressive heart failure, which will lead to a smaller oxygen delivery to the brain. And if we have the vital centers in the brain fall, that could actually lead to death. So, in short, I'm just going to quickly draw this diagram here that I've explained. So, decrease of O2 in the brain. And that itself may actually lead to death if the vital centers fall. So to summarize, we actually have a few different main types of shock, and those are hypovolemic shock, cardiogenic shock, neurogenic shock, septic shock, and anaphylactic shock. And basically, shock happens when we don't have enough blood going to our cells because of the circulatory system, and that's due to poor amounts of blood volume circulating, blood pressure being decreased, or cardiac output being decreased. And sometimes the body can negate these effects and compensate for it, but other times it can't, and that's when we have more severe effects.